Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everybody, and welcome to episode number 25 of the Better Health Guy blogcast series. Today's guest is Dr. Todd Watts, and the topic of the show is parasites in chronic illness. Dr. Todd Watts is a national board-certified chiropractic physician in Idaho, a functional wellness practitioner, and is licensed with the Pastoral Medical Association. Dr. Watts' passion for helping others restore their health so that they can live their true purpose stems from his own journey in overcoming his health struggles. His journey began at the age of 28 when he had Epstein-Barr virus, and by the time he was 40, he struggled with arthritic pain in his hands, wrists, low back, and shoulders, along with chronic headaches and muscle tightness in his neck, shoulders, and back. He also struggled with food and seasonal allergies, chronic fatigue, night sweats, muscle fatigue and twitches, brain fog, and memory issues. Attending a medical conference on Lyme disease, he identified with many of the symptoms of Lyme and its co-infections. He later tested positive with a blood test for chronic Lyme infection. On his journey with treating Lyme disease, he seemed to go through cyclical patterns of feeling good and then crashing. He met another practitioner who told him he had parasites, which was causing many of his symptoms as well as the cyclical pattern. Having gone through many Lyme protocols, he realized that addressing the parasites was vital in overcoming the Lyme disease and the rest of his symptoms. Today, Dr. Watts feels great and has sustained energy to allow him to help others, enjoy time with his family, and live his true purpose. Dr. Watts' professional and postdoctorate training includes true cellular healing, chiropractic plus kinesiology, applied kinesiology, clinical kinesiology, neuromodulation technique, acupuncture, bioresonance therapy, sacro-occipital technique, nutrition, medical IV infusion therapy, and live cell microscopy. He's taken courses on mastering functional blood chemistry, mastering thyroid, mastering brain chemistry, the neuroendocrine immunology of environmental triggers, and has trained with several Lyme disease and parasitology experts. And now, my interview with Dr. Todd Watts. All right, so welcome to the show, Dr. Watts. I was wondering if you could tell us a little bit about your own journey with both Lyme disease and parasites, and how important was it for you to come back and address the parasites even though you had already previously explored Lyme disease?
That's a great question. I think that my experience with Lyme disease is when I would address it, I took multiple products for the Lyme and the Babesia. And with those, it seemed like I would do well for a while, and then after time, I would come back and kind of crash again. And so I would go through this cycle that a lot of people that have Lyme disease experience. And so after learning about parasites from a friend of mine, another doctor, he's like, you got to really address. You got threadworm and several other kinds of parasites. You address those, and all of a sudden, bam, my energy came back. I didn't cycle anymore. And I took over a year doing a parasite cleanse, just doing multiple products. I think I took 10 products the first year I did it.
Wow. So let's talk then about, for purposes of this discussion, when we say parasites, some people think of parasites as the worms. Some people think of protozoa like Giardia and Cryptosporidium. I know there's people that also use the term parasites to talk about everything like bacteria, virus, fungus, all of those things.
Yeah.
So when we say parasite in your world, what exactly are we referring to?
So I break it down into the different classifications and to see really what's affecting people. So when I look at the cestodes or the tapeworms is one area I consider and see a lot of. Then I look also at the trematodes, which are the flukes, and then the nematodes such as threadworm, pinworm, roundworm, and then and hookworms, and then protozoans, which I see either in the blood or the small microscopic parasites that we know with Lyme disease goes right along with that.
Right. Okay. So when we say parasites in this discussion, we're talking about both protozoa and worms. We're not talking about all the other bacteria and viruses and so on. So that's good to set the stage there.
Correct.
So In the United States, it's interesting to me that many people think of parasites as a third world country problem. Oh no, I've never left the US, I couldn't possibly have parasites. And yet I've read studies of, salad bars in major cities that have had worm eggs. I've seen people that have gone to reputable stores and bought fish and cut it open and seen large worms in fish. I know we've all seen the videos of sushi and so on. So is it fairly common that people can acquire parasites when they haven't foreignly traveled? And what are some of the sources of infection for parasites?
I really believe so. I think that just because there are ultimately multiple factors that can play into this: water sources such as rivers, lakes, water that we drink, the animals that we're around. So a lot of patients I see, I always ask them about, do you have dogs, cats, horses, cattle? Those are the most common things. And then the other thing is you touch the doorknob or a grocery cart. And one study I saw showed 85% of the grocery carts, they did 100 grocery carts, 85 of them had fecal matter on them.
Okay, I learned something new in this talk already.
Okay, so it was just disgusting. And now I'm like paranoid when I go to the store. I'm always wiping everything down. But that's part of life, right? We just get exposed to it. Our immune system needs to be hopefully to the level that we can just fight off infection. But many times there's a lot of things that are suppressed in our bodies that doesn't allow us to then fight that off.
Another good reason for food delivery services, maybe. Avoid the shopping cart. So what are some of the warning signs that people should think about that might clue them into the possibility that they may have a parasite issue that they should explore more with their practitioner?
So I divide that up in two ways. One with children, most common signs with children, and one with adults. With children, we see grinding their teeth at night, biting their fingernails, can't sit still, itching kind of their bum all the time, restlessness at night, mood swings. Those all can happen with adults as well, but with adults, we see more things like headaches, insomnia, eczema, hives, fatigue is very common with it. Also can affect digestion and depression, anxiety, which is very common because so much of those neurotransmitters are made in the gut. I look at low stomach acid, blood sugar dysregulation. In some women, UTIs are very common. They keep getting them over and over, so then they need to consider parasites. Fibromyalgia issues and joint pain could be related to it as well. Seasonal allergies and food allergies and sensitivities. Anything that overstimulates the immune system can definitely have a parasite influence.
So it's a pretty big list of things then. I mean, that's the challenge, right? You look in the world of Lyme, and then you look at people that have mold exposure, and you look at people with heavy metals, and then now you look at people with parasites, and you match up those symptoms, and there's such an incredible overlap that when many of those things are in play, it's really kind of hard to just use the symptoms to distinguish. When you start treating your patients for parasites, what would you say are some of the first things that they commonly say, oh yeah, this went away or that went away? Like, what are the benefits of treating the parasites?
I think the energy starts to come back because now I think they're getting more nutrition, especially the B vitamins and minerals that can be affected. Digestion improves. So stomach pain or abdominal cramping, the bloating and gas, I think that goes along with that component of it. I see headaches go away within 3-4 weeks, sometimes 2 months on chronic migraines, because I see a lot of patients with the chronic migraine issues. So those are typical things that I see resolve more on a quicker basis.
Excellent. So if you had to guess, what percentage of people in the U.S. would you suspect have a parasite issue? And then do all of those people have some symptoms resulting from the parasites, or are there asymptomatic carriers of parasites as well?
Well, that question, as you well know, you ask many doctors, depends on which world you're in. In our world that we look at, like Dr. D'Angelo said, up to 95% of people have parasites. My joke I deal with my patients is if you have a pulse, you have parasites. And it's just part of life. So you think of it that way. Now, asymptomatic, sure, people are asymptomatic towards it because they don't know what really can be attributed with the symptoms. So the ones that really notice it more are ones that have symptoms that really stand out. And so that's where I think it's good, especially for children, to do annual parasite cleanses, or a couple of times a year I treat my children.
Well, and it's interesting because I've always seen, we focus on deworming dogs. I know a lot of people with horses, and they deal with parasites in horses, but somehow humans are just immune to these things, right? And for whatever reason, we don't even talk about regular parasite cleansing.
Yeah, it's really interesting because I had this conversation with a gal that came to see me a couple of weeks ago, and she, her son's stomach was having a lot of abdominal pain. He was throwing up a lot. And her daughter was having some skin issues. And I said, hey, do you guys have any animals? And she's like, yeah, we have a dog. In fact, a month ago, our daughter saw a worm coming out the dog's backside. I said, well, more than likely, all of you have parasites then, right? So yeah, I know people that deworm their horses every 2 months.
Yeah, it's interesting. So is there ever a case where parasites are a good thing? And so you see in various gut conditions, in autoimmune conditions, you see now where people actually are consuming parasites to modulate the Th1, Th2 balance. So how do we know that parasites that are within us are bad and need to be treated versus are some of them actually okay and maybe helping us to modulate and balance our immune system?
Wow, that's such a question that is really to be learned in the future, I think, as far as the answer. The ones that are using that to modulate the immune systems, that's a whole new area that's been explored. And we don't know what's going to happen to those people later on when those parasites either proliferate or can possibly do damage to the body. We don't know yet. I personally wouldn't want to have them in my body after what I've gone through.
Yeah, and it is interesting. My understanding is that they somehow can't reproduce, the ones that they use for purposes of medical, but it is certainly new, and it'll be interesting to see, similar to a lot of the, people talking about the fecal transplants now, and, it sounds great, but then there's obviously some downside potential as well. So it'll be interesting over time to see how that plays out. What about insomnia? Can parasites play a role in insomnia? I've heard you talk in other talks that you've done about ammonia that are produced by parasites, and that potentially can affect sleep cycles. So how do you address insomnia in a person that may be dealing with parasites?
So there's a couple of things with that. So one of the things is that they do produce ammonia similar to bacteria. So that's something I see a lot with Lyme disease. Patients that have that problem always have high loads of ammonia as well. And so there's binders that will do that. Glutamine is really good in the gut. L-ornithine, theanine are individual amino acids that can really help with that. But also I think if you address overall the essential needs of some of the neurotransmitters in the gut, that's also a key with that. So B6 and zinc tend to be depleted with a lot of those types of patients. And I use multiple products that will have a combination of those things that will restore the sleep.
Yeah, and it's interesting because then the B6 and zinc, that overlaps then with cryptopyruria and the KPD condition. And I have heard Dr. Klinghardt talk about that in the past as well, where then people are more prone to these long-standing parasitic infestations if they haven't gotten the zinc and B6 and all of those things back to reasonable levels as well.
Yeah, and we can see that in the blood work too. There's markers in the blood work of alkaline phosphatase that shows really low, and I know that person's going to have low zinc, and they're going to be really having trouble overcoming viruses and parasites and overall anything dealing with the immune system.
Perfect. So let's talk a little bit about testing. So I've also listened to another lecture you did, and you mentioned using questionnaires for parasites. So are there questionnaires that people can go online somewhere and kind of see if they have symptoms that might suggest they should reach out to their practitioner? How do they go about exploring that?
Yes, on my website, we have a questionnaire, a quiz that you can take that will answer or ask and then give you an answer as far as how you rate with that. And that should be up on our website within the next week. Okay, and it goes through a series, I think, 9 questions just to hit onto it. And then I have a more in-depth one I use here in my office as well.
Okay,
and those will lead you and say, yeah, there's a possibility that I do have parasites.
Perfect. That'll be great. From a stool testing perspective, is there a lab out there that you found helpful? I know there's one that I've found helpful in many cases, but for the most part, I've been pretty disappointed with the number of times that stool tests seem to find parasites in people where they're kind of expected. So what are your thoughts on stool testing for parasites?
I agree with that. I think you're right on that. We've sent them in, it comes back negative. We've I have patients that do endoscopies and colonoscopies, and nothing is there. And then we treat them and we see the parasites come out. So clinically, those don't match up with the labs. Now, I have recently been researching and taught and spoken with Dr. D'Angelo at Wellness, and I'm going to send some over to him and see what he comes up with on some of my patients. And the other thing, I'm looking into a couple other ones to see what the microbiome is like. So there's a couple of newer areas, the biome.com, ubiome. I'm going to be researching and seeing how the balance of bacteria may be in fungus and yeast, and then how, as we treat parasites, how that may shift for people in balancing out what they need in there. So I'm always researching and seeing what will work for people and what can balance things out. Really, I look at blood work more than I look at the stool samples.
Yeah, and Dr. D'Angelo's testing is the one that I do use and have found very helpful in my own journey over the years. He had identified a number of different protozoa, Giardia, Cryptosporidium, Blastocystis, and so
Yeah.
I've had a number of people that I've done some coaching work with that have used his testing as well and found things that many past tests never really brought to the surface. So I think that's potentially a very good option for people to explore. And then let's talk about the Scotch tape test. How is that used? When is it used? Do you have to then send it to a lab to find out what it's revealing?
The Scotch tape test is a very common test people will do to look at nighttime their kids to see if they have pinworms. And I don't think you need to send it to a stool, to a lab to get the results. I think the results are right there that we can visually see. But there's so many other kind of parasites that they may have that just because they aren't positive on that Scotch tape test doesn't mean they're not positive for parasites.
Right, very good. You mentioned on your website the visual contrast sensitivity test as a screening tool for parasites, and the one that I'm familiar with is in the world of Richie Shoemaker's work with Lyme and mold and using that as an indication of a biotoxin illness. So I'm curious how the visual contrast sensitivity test ties in then to the potential of parasites.
So I look at parasites producing the byproducts that they do, such as, just like Lyme and mold, they all have biotoxins. So I'm looking at the biotoxin levels and searching for, okay, how much is biotoxin illness taking a part of this person's life? So when you read results, it does mention parasites in some of the results stuff as a possibility as one of the options in there. So we don't have that much mold issue toxicity in Idaho, where it's really dry, compared to other places, especially in the South, where it's like mold toxicity everywhere. And so I consider that as an option as well because of that.
Yeah, no, that's great. That was new information to me as well. I'm familiar with the VCS test, but I had never heard about the connection to parasites. So that's why I wanted to kind of dig into it, because I'm like, okay, I learned something new. So what about muscle testing for parasites? Is that something that you find helpful? Is that something you explore with your patients? And what does that often reveal relative to parasites?
I find that it really helps me in knowing where they're at in the body, as well as what type of classifications they may be dealing with, and maybe individual types of parasites. And it is, in my practice up to this point, been very vital in understanding, really, in zoning in on what's the key one causing problems and where to start as well. So yeah, I've been trained in applied kinesiology and clinical kinesiology and several other things that have allowed me to learn at a deep level, because I think in kinesiology work, you only know what you know.
Right.
Okay, so I've had practitioners test patients of mine before they came to see me and they didn't have parasites, but then they came to see me and I'm like, man, you have loads of parasites and this is where they're at, and then we treat them and then we see them. So a lot of what I just think that the ones that have a lot more experience clinically in what they do in the body are more aware of that. And I'm just really seem to be dialed into that point.
What are your thoughts about parasites potentially harboring smaller organisms? So can a parasite have other bacteria, maybe even Lyme and co-infection type organisms within it? And then is that a reason that people often want to do the parasite treatment as early in the treatment cycle as possible?
So yes, I believe that is the case. That's what was the case for myself to get over the Lyme and the stuff I was dealing with. And I've seen that with multiple other patients. And then Dr. McDonald came out with the research last May and verified that was the case. And it was a really good article on saying in MS patients that the Borrelia was inside nematodes in the nervous system and the brain. And then Dr. Bedorfer and then another guy have come out also in research showing that even in the ticks, the nematodes were in the tick belly as well as the Borrelia.
Very good. What about pharmaceutical treatments for parasites? Do you find that there are cases where people need things like Alinea and Viltricide and ivermectin, or do you find that the natural options generally are sufficient for dealing with parasite issues?
Each patient's different, and I think that, yes, there's options for that. I have an osteopathic doctor that works in my clinic as well, and he will meet with patients and then write the prescriptions as they need them. And so some patients seem to be really not responding to herbs, or I've had some patients with herbs that are very sensitive to the herbs because herbs have a lot of detoxing components to them, which is great. But when people can't detox, then that's an issue. And so using some of the products that will just clear out the gut and kill out parasites that way, we've seen some very sensitive patients do relatively well with the prescriptions.
Very good.
Now, I think that you have to be careful not to overprescribe and be sure the body can detoxify and keep up with those toxins that are coming into it.
Right. Yeah, and I've seen people where a combination of both of them was really helpful as well. In fact, when I interviewed Dr. Klinghardt recently, he had said there was some research that he had seen recently that was suggesting that even the pharmaceutical options are no longer enough to entirely eradicate parasites in some people, and that there was research suggesting that combining the pharmaceuticals even with the natural herbal options may be a better way to go.
Absolutely, and that's how we treat every patient that way, typically. Some of them don't like the pharmaceutical option, so we try the best we can with the herbal option, but there's times that you have to have the pharmaceutical option.
Yeah, very good. So what are some of your favorite herbal natural therapies for parasites? What are you finding most helpful for your patients?
Good question. I use so many different ones. One of my product that I use is my baseline is the Para 1 from Cellcore Biosciences, and that's a product that I formulated that has a specific part of the Mimosa pudica plant in it, and it really helps to pull ropeworm out and mucoid plaque. And I think it also helps us to suffocate and pull out some of that roundworm and other types of parasites. It seems to be very helpful in treating threadworm as well. And then I use a number of different companies out there that have products. I don't know if you want me to name them or not, but
yeah, you're welcome to if you want.
Okay, so I've used Barlow Herbs. They have a product called Clarkia, another one called Vermicide. I've used Byron White formulas, Beyond Balance, Supreme Nutrition. I have a whole slew of things. Whatever I feel and test is going to get the best results, that's what I care about.
Yeah, those are a lot of my favorites as well. So we're kind of aligned on several of those companies. It's great. So let's mention a little bit then. You mentioned you're formulating a Para 1 product. So how do people find out more about your products? Is that also just visit your website and there'll be a link to those, or how do they learn more?
Yeah, on my website there'll be a link to those, and the website and the shopping cart should be available over the next week or two coming out. And so right now, most everybody's been getting it through my office and my clinic, and we've just been kind of holding it off, most of it off, until we actually can get it through online sources, so my clinic's not bombarded with a bunch of phone calls. But they can email us or go through my drtoddwatts.com website.
Okay, very good. So let's then talk a little bit about the moon cycles. So people often will say that they flare around the full moon. Do you find that timing the treatment around the moon cycle is important? And then do you find that after you've done the initial course of treatment, do you need to do some pulsing around the full moon for a longer period of time to address some of the parasites that actually do have eggs that they produce within the body? Or how important is that moon cycle?
In my research and studies, it seems to be pretty good. It seems to be important because I think they intake a lot more fluid into them. And so that's where you'll be more effective on treating them during that cycle. And so usually starting a couple of days ahead of time and working through that full moon cycle. So I've seen Dr. Red prescribe albendazole or prescribe ivermectin or praziquantel, and it's usually pulsed around full moon.
Very good. And then from start to finish, for most people, how long does it take to treat parasites? Is it weeks, months? Yeah, I heard you mention earlier that I think for you it was like a year. So how long is that process generally?
That's totally dependent upon the patient. On average, anywhere I'd say from 6 months to some people's protocols are up to 2 years on that process. So Dr. Klingart talks about an extensive period of time. Dr. Kackler with Kara Rivera talk about an 18-month protocol for kids with autism. It depends on how bad, how many, which type, what are the co-infections, how their immune systems are, and how well they respond.
And then when someone's on a parasite treatment protocol, how important is it to have binders on board as well?
I think it's pretty vital if they want to be sure they absorb those toxins that are being released. Another thing I think is important is be sure you're having an antimicrobial, one that's not just for parasites, but one that's more broad spectrum that treat viruses and bacteria and fungus and yeast, because those things can all be released when you're releasing ropeworm or releasing other larger parasites.
Yeah, I think that's a great point. Are there some specific binders that you really like to use?
I've used Takasumi, I've used Detox 2 with Byron White, bind with systemic formulas. I'm currently creating a couple other binders that I feel like I can pull things out from a deeper level, but I probably won't be having those come out for another couple months for that. But there's a lot of good ones out there. PRL Labs has some good binders, and I've had good luck with those.
Perfect. How often do you recommend people do either colonics or coffee enemas when they're doing a parasite cleanse? How do you really keep the gastrointestinal tract moving so that all the stuff that's being killed is really getting out of the body?
So I use a lot of Mago 7 for patients, or make sure they're using something that's going to open up and just get things moving. Some of my patients that don't have a problem moving their bowels, they don't have to have that additional component to it. But the ones that do have a problem, it's bad news if they don't get their bowels moving, as you probably know. So the enemas, that's where the enemas come into play to go with it. So doing the enemas and then making sure it's additional magnesium, Cascara sagrada, alloferox. There's different types of stimulators for the gut that people will respond to, but for the most part, most people respond to magnesium.
I've definitely had people that felt Mag 07 was really helpful, and a couple that referred to it as blasting powder.
I tell people don't follow the directions on the bottle because it says 5 at bedtime, and that could be a really bad thing in the morning. So I say start at maybe 2 and work your way up from there. But yeah, that's funny. Agree. So true.
And then is there any aspect of parasite treatment where you find that either homeopathy or frequency or energy medicine, is there some adjunct place where those kind of fit into this picture as well?
Yes. And especially with babies, I use a lot of the homeopathy, or just to get the person's body into balance so that they're not getting the infections, I think is important as well. But a lot of times there's an emotional component to this. And people will pass parasites and just have a huge emotional release, or they'll have a big emotional release and then boom, this big parasite is gone. And so I've used a lot of Bach flower remedies, or I refer people to some other practitioners that do emotional work, especially if there's been a lot of emotional trauma. I've seen that being a big component of releasing parasites.
Very good. Any of the zappers or frequency devices or anything like that that you find consistently helpful for people or no?
In my office, I use a microcurrent machine where I muscle test specific frequencies. I've also been researching into getting maybe a True Rife or see the GB4000 with the MOPA. I'm looking into a couple other ones besides the microcurrent specific. But for me, the microcurrent has been very valuable the last 4 years in dealing with both Lyme and parasites and viruses.
Is that the similar to the frequency-specific microcurrent from Carolyn McMakin, or is that a different tool?
Probably, I have a different machine, but it's I can program the frequencies in there, and
Nice.
she has a lot of those frequencies that people can get to and treat as well, and it's a good course and good information.
So tell us a little bit about flukes. I think people hear about liver flukes. I've also heard about pancreatic flukes. How are they different from what we think of as worms? And then what kinds of problems do flukes create in the body?
Well, flukes, especially in the liver, Dr. Klinghardt talks about how many feet of bile ducts that we have. It's amazing, right? And so they can clog up the cystic duct and some of the bile ducts, and that then creates a problem with our livers to detoxify and to get toxins out. So then people can't do phase 3 of detoxification or phase 2 detoxification of the liver, and then they react to everything. And so I think, especially dealing with liver flukes, that's an important thing, because then that affects our methylation processes and all the conjugation possibilities within that. Pancreatic flukes has been related towards diabetes. Intestinal flukes have been related towards cancer, intestinal cancers. You get the lung flukes that, all those can cause tissue breakdown and stress in those organs. So I believe that it is important to consider that you need to address that.
And do these things also respond to oral therapies like the mimosa and other things that you mentioned? I mean, is that enough to get at flukes that are in the pancreas, for example, or is there something different that has to be done in those cases?
I think some of the herbals can really help with that. And I also believe in the liver doing the coffee enemas. That helps to clear that out. Some people do the liver flushes as well. The Rife therapy or the microcurrent therapy can also be very helpful with those. So you see people using the Rifes over the specific parts of the body, the tubes and plasma tubes. I think a combination of all of it is important. And then the other component is really upregulating your immune system to then push things out and detoxify your body. So detoxifying your body and getting your body into the right balance is vital for keeping these infections out, and also for driving them out of the body as well.
Yeah, absolutely. I've seen some people that have had visual evidence of parasites leaving in their stool and seen that every day for years, regardless of the types of treatments that they've done. So have you seen some of those patients where you're treating and you're treating and you're treating and there's just still parasites constantly coming out? And then in those people, what have you found kind of shifts to the point that finally there is some resolution of their parasitic burden?
Yeah, it's a good question, because there's some of those that have been sick for so long that kids keep passing them out. So then that's when you have to look at the terrain and really consider what's going on: heavy metals, toxins, also just the energy. In Chinese medicine, we look at that. So then maybe changing more over to a yang diet, or just upregulating that yang energy and being able to push those things out and through the body. There's just a really complete imbalance with them, and that's what we focus on, is that when that's the case.
Yeah, and that's also one where Dr. Klinghardt has talked about KPU, cryptopyroluria, and some people, they really have the low levels of zinc, that these parasites just will keep coming and coming. Once you get the KPU, the zinc, the B6, and some of those other cofactors supported again, that a lot of times that will lead to some resolution of these parasitic issues. And I know we talked about that earlier as well. Let's talk a little bit about ropeworms and kind of get your thoughts on, I get this question all the time from people that are emailing me through the website is it a parasite? Is it a biofilm community? Is it some mucoid plaque and release of the lymphatic system. You see videos where some people show them swimming around, and there's just a lot of debate about what these actually are. So do you think that ropeworm is a parasitic worm? Do you think that it's a community of lots of different organisms, some type of biofilm community? And then maybe you can talk to us a little bit about some of your experience with treating ropeworm.
So yes, it's definitely controversial, the topic is right now. And my opinion of it is, you know what, let's just get it out. Let's just get it out of the body and clear it out. You're going to do so much better. I do have patients that do say they feel things moving around in their body and that they feel like it's even communicating with them. And I think those people are really sick and they have a lot of toxicity in their body. Biofilm, I think, is a really good way to explain it. I think as we pull it out, they get healthier. They're able to digest, assimilate nutrients so much better. So, I don't know if it's really a worm at this point in time because there's no proof of that. But what I do know is that when it gets out of the body, people make life changes with them. And my protocols with patients is usually the ones that are really bad seem to start passing ropeworm within a couple of days of me putting them on my protocols, especially my Para 1 product. So it's pretty immediate on how quickly they start passing it. And I've had a few people actually throw it out and had to help pull it out. But for the most part, 99% of people pass it out the other side, which is a good thing.
Wow. So what is mucoid plaque? Maybe you can just tell us a little bit about what is mucoid plaque, and then what are some of the tools? You mentioned the mimosa, but then how important is it to get that out of the system as well?
Well, I think the mucoid plaque is the component of constant inflammation, and the intestines secrete mucus, and I think over time it just piles up and piles up and piles up, because I've seen it come out of people that looks like beef jerky, thick beef jerky. And it makes such a difference, because when you research mucoid plaque, you see symptoms. People have sensitivities to foods, people have allergies, people have nutrient deficiencies, many similar problems, skin problems that you would see with parasites, which is because they're taking a lot of our nutrition, and then we can't absorb and utilize, and we end up reacting to everything. So clearing that out and being able to establish a whole new biome, I think, is very important. I think the mucoid plaque can create a barrier that allows parasites to exist underneath, that allows bad bacteria and fungus, yeast, metals, toxins to exist. So clearing that out will allow us to really clean the body out. And that's what I think is very important to focus on.
So it's acting essentially like another biofilm, where it's kind of hiding these organisms, and even things maybe that you're taking orally aren't getting to those pathogens because it just can't get through this barrier, essentially, right?
Exactly. I think it's a great barrier right there that doesn't allow us to fully heal. And once you remove that, then, man, it just starts to really happen.
And what are some of the ways that people can remove the mucoid plaque?
So a few products. One, the mimosa pudica we talked about. There's Standard Process has a product called ochrapepsin. I don't know if you're familiar with that, but they say that helps to dissolve it. I haven't had much experience with that. Water fast seems to really help people pass that and remove that as well. And Alex Volinsky's talked about his water fast removing ropeworm, but I think it can also do the same thing with mucoid plaque. Enzymes probably can help break it down as well. High doses of enzymes.
Okay, very good. And then what about some sources of re-exposure? So if people have pets or other family members, if they're not recovering from the treatment that you're doing, do you often need to kind of branch out and consider other sources of re-exposure? And are pets or other family members ones that you commonly look at?
Always, especially somebody that has an immune system that is suppressed. So those, they can't seem to overcome it unless you treat the whole family. So typically on most of my protocols, I give guidelines to treating the kids and the husband, and then pets, you have to treat the pets. I think that's a key source to a lot of people's problems.
Very good. And then we did talk about parasite cleansing. So do you recommend that most people do an annual parasite cleanse of some sort? Should they do it more than once a year? What do you think?
I think at least once a year, if not twice a year, to do that, especially with children because they're exposed to so many things at school. Preschool probably is loaded with it. So I'm sure every kid that goes to preschool has pinworms, or 50%. I've seen statistics show that 50% of kids in school have pinworms. But, it's just such an area where in preschool, kids with diapers and hygiene that's not as good, those things can pass around a lot easier. So you're considering ADD, ADHD, not being able to sit still, I would be looking at the gut and looking at parasites.
How important is it to optimize hydrochloric acid in the stomach to minimize getting these parasitic infections?
I think it's vital. I think it's vital that we look at doing that. And some people will take the hydrochloric acid tablets. There's other herbal options that are really good that will help upregulate and not only heal the gut lining, but also upregulate the acid. Cayenne's excellent, gentian. A lot of the bitter herbs are really good for that, and I like some of those.
Perfect. And then once you've done parasite treatment, what are some of the things that you do then to focus on healing the gut and just kind of upregulating gut function in general?
With that, I think that managing stress is important. Also, I've been using a product called GI Ultramax that seems to really help out with really cleansing the gut lining, and just pulling and repairing the leaky gut issues. Eating healthy. I mean, if you're eating a lot of that GMO foods and eating garbage out there, processed foods, that's just going to wreak havoc on your gut lining and on that whole balance that you're trying to create. So eating healthy is a really important component of doing that. Can you eat stuff sometimes? And yeah, but you have to have an overall lifestyle of eating healthy and not eating garbage.
Yeah, and the GI Ultramax, for those listening, that's from a company called Mother Earth Labs. I actually have a jar of it here as well, and so it's kind of interesting because it's a fairly new product. So the fact that you're also using it, now I'm even more excited to go start looking at it. It looks really good. What about spices or other foods, things that we can incorporate into our daily diet and routine that may minimize the chances of getting parasitic issues?
I think the spices are great, even just for healing. So cayenne, cinnamon, turmeric, cumin, getting all the different spices that are made out there. Not only are they healing to our body, but ginger, a lot of those things will help suppress and create an environment where they don't want it to be. So if you can spice up your food and make it taste great at the same time that you're healing the body, let's do that. And also, it's a great way to keep them away. There's some really good foods. I like pineapple a lot. Pineapple can help with the enzymes. Eating raw food in general is better for you than eating more of the carbohydrate or high protein diet, which will stimulate more what the parasites like to eat. So,
what do you think about papaya seeds? I've heard practitioners over the years talk about using papaya seeds as a way to get worms out of the body. Have you explored that? Does it work?
I'm not sure. I haven't explored that too much. There's papaya seeds, guava seeds, pumpkin seeds. Mm-hmm. Researching the pumpkin seeds, it might be the actual oil that's more important. BioPure has the 10-in-1 oil that I'm going to start experimenting with. I just bought and they're shipping it out to me. So I'm always looking at new things in different ways, and certain things will respond to certain parasites will respond to certain types of products over other ones. So that's where I'm always buying stuff and experimenting to see what will work through muscle testing and then through clinical application of it too.
Awesome. Yeah, I love that. So tell us, what are some of the things that you do now to optimize your health on a regular basis?
Exercise is, now that I can exercise after 9 years of not being able to exercise, that is important because now I can actually get oxygen in my body. It also produces an interleukin or cytokines that can fight infection as well. So there's a lot of benefits to exercise. What I found is, especially with threadworm, is I measure people's oxygen levels. So I get a pulse oximeter and put it on their finger, and I measure not just saturation, but perfusion. And when that perfusion is really low, I know they probably had threadworm and parasites, and they're not getting oxygen into the tissues. So it's really important that oxygen levels are brought up into the body. Oxygen heals the body. Oxygen creates a good environment for good microbes to heal. Eating well, but also I do a lot of liver stuff. I think our liver is bombarded with so many toxins and chemicals today in just the world. So like right now, I'm taking 4 liver products from Systemic Formulas, and I'm going to go through that for the next month. I'm always rotating through different types of liver products to upregulate that, making sure our lymph system is really flowing well, creating that dry state versus the wet state in the body so that we can have optimal environment for the body to heal and push out. And so that goes back to kidney function and lymphatic movement. And that's where exercise can be very important as well. Getting plenty of sleep and managing exercise. Managing stress through, we're so busy today, aren't we?
Yeah.
So many things going on. I have so many companies. I'm formulating products for my one company. I have my practice that I'm seeing patients not only in office, but then I'm training some other doctors, and I have a lot of virtual patients that I see via Skype, and so just balancing all that. Plus, I have 4 kids that are just incredible from ages 2 to 10. So I'm busy with that, and keeping that balance in life is really important to me. So my health, that's why I got back on this journey of I got to get my health back so I can live my true purpose and meaning in life. And mindset has been a key part to that, of saying, hey, I can do this, I can overcome. And a daily ritual every morning, getting up and going through of my mindset, where I'm at, addressing my spiritual component, exercising, and that's very powerful. And Tony Robbins talks about that. A lot of these guys, like, bam, that daily ritual, that morning thing, you get your day going, get that energy going, and it can change everything. Your thought processes changes your physiology, your whole body.
Yeah,
so that's
Totally agree. And it's interesting that you have so much focus on detoxification. I've, throughout my journey with Lyme and mold and parasites and all those things, I've always been more drawn to focus on the detoxification things. Of course, there's an antimicrobial aspect of a well-planned protocol as well. But in some of Dr. Klinghart's teachings, where he talks about even with parasites, that it may be the case that some of these parasites actually are helping to concentrate toxicity in the body and heavy metals and other things. And so indirectly, I think detoxifying is also helping us longer term with this parasite issue. If the parasites are there because the terrain is toxic, then yes, we need to get rid of the parasites, but we also need to focus on the detoxification and the terrain issues so that there isn't a reason that the parasites need to be there.
I agree. The first thing we focus on initially working with someone is that we have to open up detoxification pathways. And number one thing, we do not do detox, open up detox pathways, get them all working, restore physiology, liver, kidneys, colon, lymph, really get those systems flowing well before you detoxify. Start to detoxify and address the infections as well, and the magic will happen.
Yeah, absolutely agree. So tell us a little bit more as we wrap up here, how people can find you. You mentioned you've got some products that are coming out. How do people find those products? Definitely would like to hear a little bit about those new tools.
So my website is drtoddwatts.com, so DRTODDWATTS.com. And the website for my product line that I'll be launching will be cellcorebiosciences.com. So CELLCORE biosciences.com. And the reason why I named it that is because I believe that true healing happens down that cellular level. The core issues are there, and to make the changes, even the genetic or epigenetic changes, have to happen deep down into that level. And that's where toxins, like you mentioned, are really important to not only clear out of the tissues, but clear out of the cells. And restoring the cells' energy levels are super important to do that. And restoring the glutathione process, removing the inflammation that's inhibiting cellular signaling is very vital to restoring the body back to its health. So I love biochemistry. I taught biochemistry in my doctorate program as a supplemental course to help people pass. And I just think that so many things come down to that level. And it's just fascinating how the body will metabolize. And when I look at I look at blood work, I look at LDH, lactate dehydrogenase, to see if those levels are low, people can't fast. If they can't fast, it means they have blood sugar issues. That means the liver isn't kicking in to metabolizing sugar or metabolizing fat, depending on how long they can go without eating. If they can't go without eating for more than a couple hours, they depend on food, then you really know that there's some liver congestion, some liver metabolism issues. And a lot of times parasites inhibit that problem. And so I really have to look at that. Then I look at GGTP and the liver enzymes. If those are really low, then you're looking at low B6 and the pyroluria issues with the alk-phos being low as well. And consider looking at proteins. I look at the globulins and see where those are at. I look at, it's amazing how you can see the neutrophils, lymphocytes, and eosinophils. And once the immune system starts kicking in, you start making these changes, all of a sudden those eosinophils come up. And they have parasites. Before that, they're really low, like, oh, there's no parasites. It's just because they've been there so long, the immune system just ignores them and they live with it. So right. I'm able to see the shifts in managing blood and the thyroid. Thyroid is so vital to heal the body. They utilize oxygen in the cells. So that's where I consider, okay, hey, where's the thyroid? How much do we need to support that in helping the cells heal, the body heal, the gut heal? Because there's a big component between the stomach, the duodenum, and thyroid. And even motility of the digestive system as well.
So you mentioned Para-1, and that's the mimosa product.
Yeah.
So what types of parasites is mimosa good for? Is it primarily the worms? Does it also have some effect on protozoa?
It's a good question. I'm still looking into that. Researching in the literature, it says that it does have antimicrobial benefits, antibacterial, antifungal, also protozoan-based benefits to it. But what I'm seeing with it is that it really visually because I get pictures every day from patients sending me pictures. What is this? And it's ropeworm, or it's mucoid plaque, or it's Ascaris, roundworm. That's primarily what we visualize and see. The other things are harder to visualize and see. So that's more muscle testing and seeing what may affect those. Para-2 is going to be coming out that we're doing. That will be a mixture of Ndanga, neem, ginger, and clove. That'll be pretty mild and really, address some of those parasites and help create a good balance in the gut too.
Awesome. Well, this has been great. I'm excited to have a show on parasites. I've done one before with Dr. D'Angelo, and I think it's such an important topic that people oftentimes don't think about or think that it's not something that is affecting them. And so I appreciate your knowledge, appreciate you sharing your information with people today. I'm excited to try the products that you're coming up with myself. And so appreciate you taking time out of your busy day to talk to us about parasites. And thanks so much for being on the show.
Thank you for having me. I really appreciate it, Scott.
Awesome. Thanks, Dr. Watts. For more information on today's guest, visit drtoddwatts.com. That's drtoddwatts.com, or cellcorebiosciences.com. That's cellcorebiosciences.com. I appreciate your support of the Better Health Guy blogcasts series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.